Hi, I'm Dr. Andrew Neville. And one of the things that my patients are somewhat surprised about, one of my recommendations, is that I recommend they eat more salt, right? Which is contrary to everything that we've ever learned, right? But so my patients are patients with adrenal problems. Well, the adrenals do a lot in the body. One of those jobs that the adrenals have is to help you to hold on to salt. It's this hormone aldosterone, right? The main hormone is cortisol. Aldosterone's its main job, help you to hold on to salt. And in the body, water follows salt, right? It's osmosis, just the way the body works. So if the adrenals are weak and you can't hold on to salt, you can't hold on to water. This is actually why my patients periodically, or sometimes all the time, they'll urinate more frequently than the average person. That low water can also affect blood volume. So the blood volume can be low, which means blood pressure can be a little low, which means even we stand up too quick, we can get a little lightheaded, a little wobbly, right? Those are definitive indicators of somebody's got an adrenal problem, by the way. But what's much more important is that we're dehydrated, right? Not just dehydrated at a superficial level, though, dehydrated at a cellular level. And when cells are dehydrated, they don't work. They won't function, they won't do their jobs, they won't heal, and they certainly won't repair. So one of the recommendations, right, until your adrenals can do that job to help you to hold on to salt, which is so important, until your adrenals can do that job, we've got to do that job. You've got to do that job by eating more salt, believe it or not. Now, what you want to do is you want a healthy salt. A healthy salt would be an unrefined sea salt. There's a few different brands that are out there, but I'm not your purified sodium chloride that's in table salt, pure crystalline white stuff, not kosher salt. You want an unrefined sea salt. Unrefined sea salt has been unprocessed, unbleached, right? And what that means is there's a bunch of other minerals in it, which makes it look dirty. It's got a color, right? So there's Celtic sea salt is gray, and real salt is a little tan. There's the pink Himalayan stuff, which is popular. That's pink, obviously. That's become kind of my third favorite. I've seen some people do better on the other two. So the first step with my patients is salt your food, right? Don't ruin your meal, right? But don't be shy with this. This salt is really crucial. Like we've all heard this tale of, our body is 2/3 water kind of thing. Well, it's not fresh water, it's salt water, right? And that's why it's so important. So salt your food, and then I'll even have people drink a little salt in water, right? Quarter teaspoon, maybe once, twice a day, as a bit of an electrolyte drink. It's like a healthy Gatorade kind of a thing. Now, there's a conversation about salt and blood pressure. We've all been told that you got to be careful of salt. And in some patients, that's true. In some, but that's actually kind of minimal, right? Now you can check your blood pressure. You want to be, you want to stay on top of it and watch it. I mean, most of my patients tend to have lower blood pressure anyway, and then this salt doesn't affect that blood pressure at all, right? If you have high blood pressure, consult your doctor, of course, and talk to them first. But you can easily just experiment with it and try it, because I've used it in patients with normal blood pressure, and it hasn't affected blood pressure at all. Salt is one of the most basic minerals in the body. And when it's low, everything in the body just kind of grinds to a halt, right? So get your salt up. You'll feel better.